This is coronavirus brief update number 7 for Granville County EMS, dated June 3rd, 2020. And if you need to see any of the previous updates, as I have before, I've included links for those in the notes below. Now, it's been a couple weeks since we've done one of these updates, and as I mentioned at the end of update number 6, this was intentional. By early May, which was when the last update was, we had really reached a point where we were entering a wait and see kind of pattern. Transmissions peaked mid-April for coronavirus in North Carolina as predicted. Hospitalizations peaked about 2 to 3 weeks later as expected in early May. And what we were really waiting for is to see what was going to evolve from that. Were we going to enter a stable pattern of infection or a move towards a second peak or even see a decline? And now that it's been a few weeks, we really do have some data starting to emerge that tells us stuff that we did not know a month ago. And so I thought it was a good time to do another brief update to keep you on top of the numbers and talk about how those might reflect how we act in EMS. So again, as always, starting with the state data, we have about 30,000 cases total since the beginning of the pandemic. We're approaching 900 deaths, and we have about 650 hospitalized. And you'll notice that number is notably higher than previous hospitalizations in our previous updates. And I'm going to come back to that in a second because it's important. I do also want to mention Granville's data first. However, we have about 320 confirmed cases in the county total. And that doesn't mean active cases, that just means confirmed since the onset of this pandemic. About 142 of those have been in the Butner prison system. We have about 5 at Murdoch. And we've had 10 deaths in the county, and all of those have actually been within the Butner prison system. And, this is a pattern that we've seen that has held pretty steady since the onset of this pandemic, is that as the cases in Granville County have grown, about 50% of them consistently are occurring within the Butner prison system. And I just say that because, we should be cautious with every single patient that we pick up and transport. However, it helps to know where the hotspots might be. And those hotspots are going to be facilities with close quarters, where people spend lots of time inside in small spaces. So obviously prisons, long-term care facilities, skilled nursing facilities, assisted living are all high risk. And, that's what we see reflected in Granville County, not surprisingly. Our prison system is a hotspot. Also, other long-term care facilities like Murdoch in Vance County, a lot of their numbers are accounted for by a couple of nursing homes. And so, in these types of areas, we should just be extra vigilant as we go about doing our job. So what everyone really wants to know, and what we've been spending the last few weeks trying to figure out, is what's happening after the peak. As I said, transmissions peaked late April, like third week of April, as predicted. Hospitalizations peaked a couple weeks after that, which we expect. And so the question was, what was going to happen after that peak? And we know that we're not going to have this green-shaped curve. We're not going to see cases go down as quickly as they went up. Quite frankly, the federal government has simply chosen not to pursue policies that would make that possible. We know it is possible because of what we've seen in China, South Korea, Western Europe. But, for various political and practical reasons, that is unlikely to happen here in the United States. So what we're really hoping for was either this blue curve, which is a slow decline throughout the summer, or the red curve, which is more of a plateau. What we're hoping to avoid is the pink curve, where we thought we hit a plateau or a peak, but then start to see cases going up again quickly. Unfortunately, that is actually what we're seeing in North Carolina, and it does look like we're going to have a second peak during this summer. So you can see here I've combined 2 graphs for hospitalizations so that we can get a good picture of what that has looked like over the last few months. And I've talked about this before. The reason we're looking at hospitalizations is because that is the only reliable number for trying to figure out what's going on. Looking at percentage of positive tests or total positive tests really has more to do with testing policies than the actual underlying disease burden in North Carolina. And that's what we're interested in. We want to know how many people in the community have it and are transmitting it. And so we can use hospitalizations as a proxy for that. Now, the downside to using hospitalizations is because of the way this disease works. Hospitalizations tend to lag what's actually going on with transmission by about 2, maybe even 3 weeks. Because remember, it takes a couple days to develop symptoms. People tend not to get very sick until they're well into the illness. So now it's like 10, 14 days after they initially were exposed. And then, of course, people get hospitalized for longer periods of time with this illness. And so hospitalizations don't tell us what's going on today. They tell us what was going on 2 to 3 weeks ago. So you can see on this graph, there appeared to be a peak right around May 3rd. And that's not surprising because we said transmissions peaked mid-April. So about 2 to 3 weeks later, we should be seeing a peak in hospitalizations, and that's exactly what we saw. The problem is that peak was short-lived, and now you can see, particularly over the last 2 weeks, there's been a pretty steady uptick in hospitalization. And that's very concerning because, rather than plateauing or even seeing a slight decline, unfortunately, what we're possibly seeing is the beginnings of this pink shape, where we actually are heading towards a second peak during the summer, and then, as we mentioned, a likely third peak during the winter. So the question is, why are hospitalizations suddenly going up over the last few weeks? Well, as we said, that reflects behavior from about 2 to 3 weeks ago. So what was happening 2 to 3 weeks ago? Well, one thing that was happening is states near us, particularly Georgia and South Carolina, were dramatically easing their restrictions, despite many criticisms from various scientific groups that it was too early to do so. Now, we did not relax our social distancing or business restrictions in North Carolina, but North Carolinians actually started to act like things were becoming less restricted. And we know that from mobile cell phone data. So what we started to see is after the reported peak in mid-April, all of a sudden North Carolinians who had been very good at stay-at-home orders started becoming more mobile. And then we see that jump even more right around the time that other states eased their restrictions. So in fact, we actually had more mobility than Georgia did in the first week of May, even though Georgia was the state that opened hair salons and movie theaters and was easing their restrictions. So we were easing up even though officially we had not lifted the restrictions. The second issue is that we then, of course, did ease restrictions. And I'm sure most of you have noticed on the roads and parking lots, particularly in the last few weeks, things becoming just more busy, life taking on a semblance of normal. And so the combination of acting as though restrictions were eased and starting late April, and then, of course, the actual easing of restrictions that began sort of mid this month are likely what's driving the growth that we're seeing. And this growth is being reflected in a lot of other states, too. The most concerning part of this, of course, is that the data that we have doesn't yet show us what has changed as a result of things that happened in the last 1 to 2 weeks. So, two big things that have happened. This photo on the left, the first is Memorial Day. We know that there was a tremendous amount of social mixing and interaction in many states as a result of the holiday weekend. And then, of course, we have the protests, which are now occurring in most large cities in the United States. And we know that these two types of events are both extremely high risk. And so there's significant concern among epidemiologists that starting halfway through June, third week of June, we're probably going to see a dramatic increase in numbers that reflects what actually happened at the beginning of this month and over the last week. And I think it's important to tell all of you this because we need to respond to the reality. The truth is that, per the numbers, it is more dangerous in North Carolina today than it has ever been at any other time during this pandemic. There are more infected people. There's more infection occurring. The hospitalization rate is the highest it's been, which means we are the closest we have ever been to running out of resources, even though we still have a fair way to go. And so we should be acting accordingly. It's not the time to become lackadaisical about PPE or about our behaviors outside of work. And, to the extent possible, you should communicate this to your family, your friends, the people you care about, because, if we were being really strict about masks and social distancing a month ago, then it doesn't make any sense to be any less strict about those things now. In fact, now is the time to be more vigilant. So I know that's not what anyone wants to hear. It's certainly not what I wanted to be saying this time around. I was hoping by the time that we gave this seventh update that we could say that we were definitively plateauing or seeing a drop in cases, but it is what it is, and we have to work within those confines. On a different note, some good news is that PPE, when used appropriately, really does seem to work. And there's actually some very interesting studies that just came out of New York State and New York City. And you may or may not be aware, New York has done a phenomenal job of widespread antibody testing. And so one of the things they did is they tested random samples of the population in New York City, as well as other parts of New York that were hard hit, like Westchester County, which is just north of New York City and where the original outbreak was. And what they did is they compared that to healthcare providers working on the front lines in those areas. Now, we know healthcare providers in those areas were getting exposed on a daily basis to coronavirus. They were in very high risk positions in the ER, in the EMS, in the hospital. And yet, what we see is actually healthcare providers have notably lower infectious rates than the general public. And so that's probably due to the fact that they were being extremely vigilant about PPE. It also probably reflects the fact that healthcare providers probably were more cautious in their personal lives as well. But the good news is it means that the PPE must be working, because if PPE did not work well, then these healthcare providers would have much higher percentages of infection than the general public. But in fact, they have less. And so I think that's an important study to talk about and to share, because it really should give you some faith in your PPE. If you wear it, if you don and doff it the correct way, it really provides a very high level of protection. And speaking of that protection, one more thing I just want to reiterate, and we talked about this in our last update, is making sure that you're also protecting your eyes. We know that people are doing a very good job of wearing masks in our EMS system, but the data, the inventory that we're running through suggests that perhaps we could be doing a little bit better job protecting our eyes as well. And eyes are probably a significant transmission source, at least in terms of becoming infected. And there's actually a study that came out of Korea recently, and this has not been peer reviewed yet, but what they did is they compared coronavirus or COVID to another coronavirus, SARS, which is the virus that COVID is most closely related to. And what they were trying to figure out is, why is COVID more infectious than any other coronavirus, including the SARS virus, which is the one that it's most closely genetically related to. And one of the things they looked at is at how well the virus appears to attach to and invade certain types of tissue. And one of the things they found is that in the lower respiratory system, it didn't seem to be that different from SARS, but in the very upper part of the respiratory system, the upper nasal area, the sinus cavities, and the eyes, the conjunctival tissue, that the virus seemed to be much better at attaching and invading. In their study, they said by a factor of about 80 times better at attaching and invading. And so the eyes may be a bigger source of transmission, or a bigger risk for transmission, than we realize. And so that's just to reiterate the fact that you really should be protecting your eyes. It's so easy to reach up and rub our eye or adjust our contact lens or do all these little things that we don't even think about on a day-to-day basis that would be bringing our hands to our eyes and increasing our risk for infection. And really the best way around that is to just be wearing something over your eyes at all times as possible. So I will keep things brief there. I don't have any clinical updates as to what you should be doing different for your patients. But I think this data is helpful in terms of reinforcing what you should be doing for yourself, trusting your PPE, but of course you have to be wearing it in order for it to work. And also just knowing that unfortunately the risk is out there and the risk is actually accelerating. And, we should act accordingly, both in our professional and personal lives. So with that, thank you for your time. Please email me or Alan or Jonathan if you have any questions. And again, thank you for all that you're doing, and stay safe.